Is your knee pain caused by arthritis? Maybe it's a torn meniscus, or it could be something else. Knowing why your knee hurts is important because the cause of pain usually guides us on how a doctor would treat it. Hi, my name is Dr. Marc Gruner. I'm a board-certified sports medicine physician. Knee pain is one of the most common reasons patients come in to see me. In today's video, we are going to get into how I diagnose the cause of knee pain and how the cause of knee pain matters to you as a patient. Here's the truth about knee pain. If you don't know the cause, you can't fix the pain. Stick around until the end because I'll explain how treatment differs depending on what actually is causing your knee pain, which options really work. One of the biggest causes of knee pain is knee arthritis. I ask my patients, do your knees feel stiff when you wake up? Do your knees ache when you climb stairs? Do you have crepitus or a small cracking in your knees? Or do your knees swell after standing all day? If all or some of these symptoms are true, then arthritis could be the reason. When I suspect arthritis, I start by asking when your knee pain happens and what makes it better or worse. Pain that gets worse with movement but improves with rest is a common sign of knee arthritis. During your exam, I will check for warmth, swelling, and grinding when you move your knee. In some cases, I may also order an x-ray to see if the cartilage is damaged and the severity of your knee arthritis. The cartilage is the smooth padding between your bones that sometimes gets worn down with arthritis. This is an example of your knee joint, and you can see that the very inner thinner lining that's on the tibia, that's your leg bone, or the femur, that's your thigh bone, is the cartilage that protects your joints and gets worn down with arthritis. There's also cartilage around the kneecap, which is called patellofemoral joint, patella meaning the kneecap or the femur being the thigh bone, and cartilage can get worn down here also. Once a doctor knows that you likely have knee arthritis, the next question is, do you really need knee surgery, or can you manage the inflammation and pain and slow down the damage with other therapies? Keep watching because the answer to this question really changes with how we treat it. Another cause of knee pain is a meniscus tear. The meniscus is the cushion between the thigh bone, which is called the femur, and the leg bone, which is called the tibia. There are two parts of the meniscus. On the inside of your knee, there's the medial meniscus, and on the outside of your knee, there's the lateral meniscus. And they're anchored by very tough ligaments that hold the meniscus together. If you have knee pain, or your knee suddenly locks, clicks, or catches after a twist or deep squat, it might be a meniscus tear. In my clinic, I use a combination of physical exam maneuvers such as bending your knee and rotating your knee to help determine if a tear is likely by putting more pressure on that side of the meniscus. If the diagnosis remains unclear, I may order an MRI, which can look at soft tissues or ligaments and can also see if there's a meniscus tear. Most meniscus tears can be managed with physical therapy and rehabilitation, while surgery is reserved for cases of persistent locking or tears that get progressively worse. A third problem of knee pain could be a problem with a ligament in the knee. There are 4 different types of ligaments in the knee. In the back of the knee, there is the PCL, or called the posterior cruciate ligament. In the front of the knee, there's a knee deep in the center called the ACL, or the anterior cruciate ligament. And then there's 2 ligaments on the side of the knee. There's, on the outside of the knee, the lateral collateral ligament. On the inside of the knee, the medial collateral ligament. This is an important stabilizer of the knee, and when injured, can be a cause of knee pain. If you heard a pop, or your knee swells, your knee suddenly gives out, you could have a ligament injury. Ligaments are strong bands that hold your knee together, and the ACL is the most common ligament that is commonly torn. Ligament injuries happen in sports that involve jumping, cutting, pivoting, or non-contact injuries. I'll do some special tests to see how stable your knee feels. If it feels loose or wobbly, it could be a partial or full ACL tear. Sometimes I may order an MRI of the knee if needed. The big question patients always ask me is, can a torn ligament heal without surgery? Stick around because I'll explain what makes the difference a little later. Jumper's knee is another cause of knee pain. If you're a runner, athlete, or just someone active and you feel pain below your kneecap, so this is your kneecap, and you're having pain just below your kneecap, you might have tendinopathy where the tendon of the patella or the kneecap can be inflamed or injured. When I press on the tendon, and you feel tenderness or pain, especially when you're straightening your leg, that's a sign that someone might have patellar tendonitis. In the office, in conjunction with my physical exam, I sometimes will do an ultrasound to see if the tendon is injured or torn. Here's something people with knee pain don't realize. Tendonitis pain or tendinosis pain doesn't always mean the tendon is damaged. It's often your body telling you the tendon has been overloaded. Instead of only resting, treatment should focus on retraining and strengthening that tendon so it can handle the load of the activity you enjoy. Keep watching because this is one of the most common causes I see in active patients and is very treatable once you understand it. A fifth cause of knee pain could be bursitis. If your knee looks swollen or feels warm, especially in the front, you might have bursitis. The bursa can be either in the front, next to the tendons, or on the side, next to where the IT band inserts on the outside of your knee. The bursa is a small fluid sac that helps your knee move smoothly. When it gets irritated or inflamed, it can cause pain and swelling in the knee. When I examine patients, I gently press around the joint to find if the knee is sore. I can also use ultrasound or an MRI to check more closely. The important thing is figuring out whether it's just inflammation from pressure or if there's something deeper that's causing the irritation. That's what shapes my treatment plan. And you'll want to hear that part because treating bursitis early can stop it from becoming a chronic problem. Patients may know that sometimes knee pain does not come from the knee at all. Weak hips, flat feet, or spine alignment issues can change how you walk and put extra pressure on your knees. When I suspect that, I look at your whole lower body, your hips, your back, and your feet. I might watch you walk, check your balance, or test your hip strength. And here's something that surprises a lot of patients. Sometimes fixing knee pain does not always mean we always treat the knee directly. I'll show you what that means when we talk about alignment, because understanding this can change the way you think about knee pain completely. Now that you know the main causes of knee pain, let's connect that to how treatment actually causes changes. Once we figure out what's causing your pain, we can choose the right plan and see where it really matters. When treating knee arthritis in the early stages, patients can try low-impact exercises, physical therapy, cortisone injections, and anti-inflammatory medications. But depending on the patient, I also consider advanced treatments like platelet-rich plasma or PRP or hyaluronic acid injections, also called gel injections, that help the joint move more smoothly. These types of regenerative medicine in knee arthritis are great when patients really want to avoid surgery and they have mild to moderate arthritis. If your knee pain is from a meniscus tear, the treatment depends on how big the tear is. Small ones often heal with rest and therapy. Larger tears that cause locking or catching may need arthroscopic surgery to repair or remove the damaged tissue. When it comes to treating knee pain from ligament injuries, there's a lot to consider. Partial tears can get better with bracing and rehab, but full tears might need surgery, especially if you're an athlete with an active lifestyle who needs full knee stability. Full ACL ruptures in younger athletes might need surgery. The ligaments in the back of the knee, the posterior cruciate ligament, can usually be managed conservatively. Additionally, the MCL, which is on the inside of the knee, or the LCL, which is done on the outside part of the knee, also can sometimes be treated conservatively. When you have multiple ligament tears, that's when surgery might be indicated if there is gross instability. For knee tendonitis, I'm a doctor who really focuses on rebuilding strength. While each patient is unique, I usually recommend special physical therapy exercises that strengthen the tendon as the first approach. If this doesn't improve, we will do an ultrasound in the office or get an MRI, and we will look to see if there are conservative treatment options that might help. Treatment options might include PRP injections, tendon scraping, or percutaneous tenotomy, which can be designed with physical therapy. If you have bursitis of the knee, rest, ice, and compression are usually enough. But if the swelling doesn't go down, I am able to remove the fluid in the office under ultrasound and might even consider a small steroid injection to calm down the inflammation quickly. And if your knee pain comes from poor alignment, we will fix the root cause. Orthotics, posture training, hip and core exercises, and gait retraining can take pressure off your knees and prevent future problems. Knee pain may not be related to just one thing. The key is finding the exact cause, because that's what determines how you get better. Hope you found this helpful, and remember to hit like and subscribe below, and I'll see you in the next video.